Yes, ma'am. Health, an indispensable part of human life, is the state of complete physical and mental well being. We all know that physical health is important, but it is less known that physical health is closely associated with mental health. And it's proof that having a mind which is healthy leads to a healthy body. As Russell Wilson rightly said, if we start being honest about our pain, our anger, and our shortcomings, instead of pretending they don't exist, then maybe we'll leave the world a better place than we found it. A warm good evening to Principal Ma'am, Vice Principal Ma'am, teachers, students, and parents. On behalf of Bharatiya Vidya Bhavan's Mehta Vidyalaya, it's my pleasure to cordially welcome you all to the World Mental Health Day celebration. I'm honored to welcome a very special guest on this event, Dr. Professor Sona Kaushal Gupta, a neuropsychologist, a medical doctor and pathologist. She is the founder of Pari Foundation, an NGO which works on mental health awareness in youth about saying no to drug abuse and helps them to deal with other mental health issues. A CBSE counselor and a columnist for leading newspapers, she is a parent coach and the counselor for behavioral issues in children ranging from anxiety, depression, and stress. A recipient of BC Roy National Award, Best Doctors Award by IMA, and Nari Shakti Award, she has spoken on many national and international platforms. She has been a speaker for mental health awareness on TV shows such as DD Dehradun and ZTV. She firmly believes that there can be no health without mental health. It's my proud privilege to welcome you, ma'am.
Thank you so much. Thank you so much for the warm welcome. And I'm honored to be here with all of you all. And
Thank
I'm
you so much, ma'am.
grateful to the principal and the vice principal, ma'am, for allowing me to share my thoughts. And of course, Aradhna, ma'am, for allowing me to be here with you all. Thank you all.
I would like to invite you, ma'am, to address the gathering with regards to the role of parents in promoting positive mental health of children. Dr. Sona, ma'am, the stage is all yours.
Thank you so much. Just tell me how much time do I have to be speaking?
Ma'am, we have 45 minutes for the session and last 15 minutes to take up
Okay.
questions from the chat box.
So that means, great. So that means it's 5:33 now. So I think I'll be with you till 6. And then 15 minutes for your questions.
We are there. I mean, if you want to take the session for 30, 35, 45 minutes, whatever you feel, we have full 1 hour with us. So, but last 15, 20 minutes for the questions. We'll pick up some questions from the chat box.
Yeah. I hope the parents are there with us.
Parents have started joining, ma'am. I am seeing the live streaming. They have started joining because we started our exact time.
Great.
So parents are joining.
Great. So thank you all. Of course, I would like to just tell you that a bit of my story, how I got into all this, was that I'm a medical doctor basically. So while I was studying my medical studies from King George Medical University, Lucknow, I saw a lot of distress in my patients who were being treated with medicines, but they were still very unhappy, and so were their relatives. Now, a lot of my colleagues, while they were giving exams, and me too, we underwent a lot of stress. And at that point of time, in the early 80s and late 70s, there was not much about psychology and, cognitive behavior therapy and mind management and mental health. It was not so much there then. We didn't know much of it. A lot of my friends in the medical colleges went into suffered stress, depression, had to take medicines. So therefore, at that very point, that laid the foundation in me that something is there other than medicines, which is affecting the human brain. Now, when I got into my practice and I was teaching the medical students, the same story repeated. And then sadly, by then, that was in the early 90s, I came into contact with students who were so much depressed, and some of them were suicidal. So then again, it was firmly ingrained in me that my calling is elsewhere other than medical education to the medical students. And I went into human behavior and human thinking, and I did my master's in psychology. And I wanted to reach out to students who were in stress depression, because I had seen that all my study period, that there's a lot of stress and depression in youth and people around them and their families and their parents. So I made this platform for myself and I called it Pari Foundation. Pari is an acronym for Psychological Assistance and Rehabilitation in Children, PARI. So then over the years, it's there for I think 12 years से ज़्यादा हो गया. Lots of people have joined me. But basically हम लोग करते क्या हैं? It's a platform via which we go to masses, maybe schools, colleges, universities, online, offline, wherever we find that we can find those areas where there are students with red flags, where there are student communities who should be addressed to, and their parents, and maybe their teachers and youth and the younger people. So and it really, we went to all the schools and colleges, and we made it a sort of research oriented database sort of an adventure, and we got a lot of findings from that. And we came to know that excuse me, 50% of students are stressed. 50% of their parents, the students who are stressed have all the parents who are stressed too. Among the stressed students, the girls and boys are into equal ratios. And we also found out that among these students who are stressed, anxious, or depressed, many of them go into maladaptive coping. So they went into drugs and addictions. So we started with this Say No to Drugs campaign. And our motto is that awareness empowers prevention, because prevention is better than cure. And how to prevent it? By awareness. So awareness empowers prevention. And of course, mental health is a most important factor. And we took it to the masses and it made a lot of effect, and it still is. So the thing is, what I want to tell you is that this awareness, ये जो हम बातचीत कर रहे हैं, this talk that we are doing is really very effective for the children, for the parents, for everyone. And it brings awareness into them, and then they have their interactive session of question answers, which again, really clears up a lots of doubts. Having said that, because of this work which we had done, I got this National President Award also for the work we are doing, and it's an ongoing process. And as you know, excuse me, today this is at the crux. We are at the peak, nearly at the peak of it. You're seeing in the news, so many people are into drugs and these celebrities and everything. So the only thing is that we have to go to the students and you have to talk to them in such a scientific way, so that they get, they understand the fact that yes, really, stress is hazardous and stress can be managed. It can be prevented if we are aware of it. But if we do get into the clutches of stress, it can be managed. And stress management techniques are important. Other than that, how to cope, we teach them adaptive coping, and we tell them how hazardous drugs are. Now, the center of the situation are the parents. So parenting is such a ongoing scientific method that I don't feel that anyone ever feels that they are perfect in it. Absolutely. Today when I look, absolutely, when I'm do I keep talking, or do we interact also?
Ma'am, it is going live stream, so I think questions will only come on the chat box. But
right, so I'll finish off my thing, and please tell me when I have to, just tell me 5 minutes before when I should be ending it. So what I want to tell you is that parenting is such a ongoing thing that parents need to and I can speak in English.
Yes, ma'am.
Or should it be in Hindi?
No,
complete English. Okay. So parents should understand the fact that it's not an easy thing. It's not natural. Parenting was natural maybe some 2 or 3 decades back when our grandparents were there. But today, with the onset of the social media and the internet and everything which is going around our lives in such a haywire way, parenting has really taken a 360 degrees turn. What parents need to know is that they are in stress. And no parent can say that I'm not stressed. Even I am in stress. I was in stress when my children were teenagers. Today, when they are grown up, I still do get those moments of stress where I have to talk it, but I know the way. I'm aware of how to cope with it, prevent it, and reach out to my children. So this awareness is very important in parenting, to how to reach out to your children. Because let me tell you that every parent, feels at times may feel guilty that they have not brought up their children very well, or they've done some mistakes, or they may feel guilty while we are telling them that you shouldn't do this or you should do this. But let me tell you, children feel all the more bad, they feel all the more stressed, they feel all the more hurt when they know that their parents are not reaching out or understanding them. So the children are double folded with pressures. They have their own problems which they are suffering, their own areas of conflicts. But on top of that, when they feel that their parents are not able to understand them, or the parents are not happy with them, that adds on to their hurt. So it's very important for parents to understand that they are the center of their child's life. So they have, how to reach out to their children is very, very important. And these are some of the things I'll be talking to you in my talk. Because while we go out for our to the colleges and schools, and we talk to the children, they tell us such things about their parents. They say, ma'am, we are well aware of what to do, but we would request you to please reach out to our parents so that they should understand what the actual problem is. Can I see your picture, please, Aradhna? I would like to be the frame. If I could get somebody else on the frame.
I'm there, ma'am.
I would like to see you there, but I'm not able to see you. My frame has come.
Ma'am, it's full screen now, actually.
Ma'am?
It's full screen.
Okay.
Your frame is full screen now.
Yeah, yes, but can you put it smaller? Because I don't want to be full screen. I want to speak to someone. It's looking as if I'm speaking to myself.
Okay.
Ma'am, even Dr. Jyoti is there. We both are there.
So ma'am doesn't want full screen.
Okay, no, I don't want it. It looks as if I'm talking to myself.
Okay, Kushagra, Anya, and they'll do
right. That's much better. Thank you so much. It feels as if I'm interacting with you. So what I want to tell you is that mental health has over the years taken a very front seat in our lives, and we have to spread this awareness to everyone that to ignore the mental health is very hazardous, because from a good mental health comes a good physical health. The theme of this year's Mental Health Day is mental health in an unequal world. Now, it's unequal because it was unequal. I mean, everything is unequal, not fair in the world. We all know it. Some are rich, some are poor, some are happy, some are sad, some are etc., etc. But after COVID-19, it has seen that these gaps have grown larger. The richer have become richer, the poorer have become poorer, and physical ailments have been highlighted more after COVID-19. We've all gone after doctors, and we've all gone for tests and for our respirations and our lungs and our bloods and everything to be, physically fit. And mental health has taken a back seat. So therefore, it's been very unequal all the more now after COVID-19. So this awareness we have to bring, that COVID-19 has brought about a lot of mental health issues in our children and people. So there is a lot of stress, anxiety, and depression. The children working from home have been very stressed because of various reasons. Parents with the children have been more stressed. They have to cope up the work and the children. And there is a lot of interpersonal conflicts. There is a lot of domestic violence has increased. Geriatric old age problems have also increased. So now who will listen to the parents? Who will listen to the children? The parents. So the need of the hour is to understand that mental health has to be taken good care of, and it is as important as your physical health, because 80% of our diseases are said to be psychosomatic. That means they are body aches, they are body problems, headaches, but the root cause of those problems is the stress in the mind. So stress leading to body pains is psychosomatic. So psychosomatic diseases can be treated with medicines, but until you go to the root cause of it, they'll come back to you again, and you'll keep going again and again to the doctors. Therefore, the migraines, therefore the hypertensions, therefore the diabetes, all are psychosomatic now. We club them because most of them are due to stress. So the need of the hour is a wake-up call and for this mental health day, that take good care of your mental health. Coming to parenting, parents need to understand that parenting, the first myth that we need to break in parenting is that parenting is not about, counseling or guiding or, educating or, controlling the child. It's nothing to do with the child. It's all about the parent. It's a big myth. And this is a very important part of parenting, which we should bring forth to the parents. Parenting is all about yourself as a parent. It is your state of mind, how happy or unhappy or stressed or angry you are. Because if you are calm, this calmness is bound to go to your child and, make him feel calm too. And you'll both resolve the differences much better. So parenting, we should understand, is about our self-care as parents, our mental health and our physical health as parents. And the other myth which I want to bring to the notice of parents is that parenting is nothing to do with punishments. It's nothing to do with controlling the child, criticizing the child, or being responsible of making the child something that you want to make him to be. Because a lot of parents come and tell me that we couldn't study in our times, we didn't have the facilities, but we are sending our children to the best of schools, we are giving him the most money, as much money as he needs. So we want him to be so and so, such and such thing. So we are giving everything, and my child should become that. Children are not robots. So my first take to the parent is that first, when you have children and even otherwise, the first care, as we all know, is self care. And self care may mental health awareness is telling us, the mental health day is telling us, look after your mental health. So what is mental, what to look after your mental health? They'll ask, usme kya dekhna, what should we look after? What should we look after? Mental wellness is all about how calm and peaceful you are feeling, how well you are sleeping, how well you are interacting in your relationships and bonding with your relationships at home and at work, and how well you are able to cope up with all the problems which are coming day to day in your lives. If your coping strategies are not good enough and you are going into stress, then, or they are maladaptive and you're going into drugs and addictions and cigarette smoking, and then you're telling your children that no, don't take drugs and addiction, don't just go into cigarette smoking, but you're doing it yourself, it's not going to work that way. So please look after yourself. Stop controlling, stop lecturing, stop giving big lectures to your children. Children get fed up of it. They come and tell us, ma'am, whenever our parents start, they don't stop. Because you have an audience who is easily available to you. You have children, they can't revolt because you're the mother, you're the father, they're scared of you. So the catharsis of the parents, their stress just comes out to the children, and blah 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 they go. And on top of it, don't compare your child to others. Is everybody knows that, don't compare to others, we have all heard of it. Your child is important as he or she is, but don't compare even yourself to them. We always come up with stories that in my days I did this and I did this and I was this and I didn't have this and you have this. So stop putting your pressures and your stories onto children. What I want to tell parents is, this is the day of, there are terms like conscious parenting, there are terms like spiritual parenting which are coming up, and they are really important, which means that your child may have come through you. You have born him, of course, but you don't own him. He's an individual. He's an individual with his own set of beliefs, with his own sets. He's come to life. And as if you take up spiritual parenting and you say that he's come up with a baggage of whatever from his past karma, you may or may not relate to that. But you have to relate to the fact that you don't own or control to the child. And if you are a spiritual person, the spiritual dimension, of course, adds up, that he is an entity on his own journey of life, as you are in your own journey of life. You are here together in this karma, and maybe you were somewhere else in the last one. So having said all that, I want to tell the parents that, first of all, self-care, look after who you are, look after your own baggages, your own conflicts, solve them. and take help, because parents, when they come to you, they say, ma'am, and the worst part is that the parent comes to you with a child and he expects the child to sit with him while he's telling out the whole story of the child in front of him. He wants the child to hear that. And believe you me, that he's not going to talk good of the child when he's coming to a counselor or a doctor. So then the next time he says, my child doesn't want to come. Who wants to come to be belittled or spoken bad of in front of the another person by the parent? So it should be understood that whenever you have children who have problems, understand that there are you have to differentiate the child from the problem in your mind. So this is my tip to the parents, that don't say my child is rebellious. Don't say my child doesn't study. Don't say my child is, is a smoker or is a liar. Don't label the problem with the child. So in your mind, separate a child from the problem. And everybody has problems, has areas, gray shades of areas in their personality while they are going through life. And it is those gray shades of areas or those problems which we need to work upon, maybe together with help, or maybe ourselves, or either way, or read or videos and it and be aware how to solve those problems. You're solving the problem of lying. Supposing a child is a liar, is lying, and you say he's a liar. So you're clubbing the lie with the child, and the self-esteem of the child comes down immediately. So self-esteem is something which we have to see, that the child is always, above, because if he falls in self-esteem, he's not going to be able to cope up with anything else in life. So what I want to say is that appreciate the child, and say that, oh, you're wonderful, you're good, and I love you, and we'll together have solve out these problems which are there. And it's a normal part of growing up. We all have problems. So instead of magnifying the issue, that, oh my God, you've done this, you've taken this, you've failed. Instead of magnifying the problem, please demagnify it and tell him it's a problem, we'll solve it out. But I know that you are good, so empower the child. So awareness, empowering will prevent child from going into any sort of problems later on. So empower the child that you can solve out whatever problems you are facing, and then discuss the problems with him or take help, and let him understand and let him manage those problems himself. Like supposing he's lying, you just tell him that it's okay. Lying, of course, we all know it's not correct, but since you have lied and you're accepting the fact that you've done it and it's a mistake, so let's talk about it. Why did you lie? What was there that you did not share with me? And I'm always there with you. So why does a child lie? Because he fears. The fear factor, and is something which we are instilling in our children as parents day by day. Though we are giving them everything possible, we are doing everything for them, but with our tone, with the way we are talking, with our own set of beliefs which we have been brought up with, we are instilling fear into a child. If you do this, then this will happen. If you don't get this, you will not. If you don't earn this fear, again, is very demotivating. It's a negative emotion, and all these things add up to stress in the mind, and of course makes the problem more complex for the child. On top of it, I want to talk about uh, that's why I said that the parent should work on their fears, remove them first. So be a happy parent, remove your fears. And how do you be a happy parent? Somebody asked me once, how do you be a happy parent? Happiness is not, you're going to tell yourself, I'm going to be a happy parent, yeah, you should be a happy child. It's not going to happen that way. So how do you be happy? Kaise khush rahenge? So what I feel is that my agenda is that you can only be happy when you're focused on what you're doing and you're putting everything into what you are doing. So when you're doing and focusing, that means you're in the now moment, you're in the present moment. So that is again a part of happiness. And we are totally focused on doing what you're doing. So the result which that work will give you the happiness. So the happiness comes from results of the work that you do. So involve yourself into activities of your whatever you want to do. Involve your children into activities. And how will you involve your children into activities? Again, you know it, by self-esteem. They can only by empowering them. So empowering means self-esteem. Don't let the child feel that he's lesser than anyone, or he is lesser than you, or he will be lesser than anyone else. Because self-esteem is how I look at myself. So let the child have an image of himself as he is very good, and that image to the child is going to come from the parent. They are the first teachers from home who instill self-esteem or decrease the self-esteem in a child. And when a child has no self-esteem, it's like no petrol in the car. The car doesn't run. So they go into a low body image, a low self-image, a low in everything that they're doing, and they feel helpless, hopeless, worthless. That leads to depression and all. So let's together as parents understand this. I hope the parents are understanding it and it's not going to go very deep. They don't feel that it's something so deep. They can come up with questions, of course. Don't order a child to do something. Don't control. Don't go and study. What will happen if you don't study, you'll fail. So two things: you're ordering, you're controlling, and you are instilling fear. If you want your child to do something, do it yourself first. There are very many parents who say that we want our children to take part in cultural, to sing, to dance, to skate. Do it yourself first, huh? And let's see how competent you are in that instead of ordering them to do it. So when they see you doing it, they'll do it. So as you all know, we all know that the doing part of what the parents do is more effective than what they say and talk. The behaving, the doing.
Absolutely. Ma'am, because many times as school counselor, I come across parents and they come and they tell me that, ma'am, ye book nahi padhta hai, koi story book nahi padhta hai, doesn't eat, he eats on the bed, he doesn't get up. My first question is, ma'am, do you read any book? I mean, nahi, ma'am, mujhe time bhi nahi milta.
I'm in the kitchen.
I'm in the kitchen. And your house has a dining table? Yeah, ma'am, but us pe koi baithta nahi hai. Why do you expect the child to be there?
Absolutely.
So yes, ma'am, these are common, and I tell parents that the child is not listening to you; he's observing you. So you need to be their role model. You have to behave the way you want to see the child.
Exactly. And secondly, of course, we are not saying here that kitchen is not important or cooking is not important. These are all, but then again, time management. How the parents? So it's all about the parents, how they are managing their time, how they are managing their feelings. Because what they are thinking and doing and behaving is what the child will think and do and behave. And so therefore manage your time well. Your child will even manage his or her time well. Sit down and read the paper, sit down and read something while your child is studying. While they're growing up, they'll look at you and they'll do the same thing. So there is a parent who came to me and he says that, ma'am, my child doesn't laugh at all. He's always so serious. And the look of the parent was so grim and proper. And I asked him, how many times do you laugh? He says, ma'am, marne ki to fursat nahi hai. Where will I laugh? So when you are not doing it, you are telling your child it's not going to work, and it doesn't work. So the parents need to. So as I started off, parenting is all about you. It's all about the parent. So change yourself to change the child. And changing yourself doesn't mean drastic changes. These are all positive things, because we all wish good for our children. So those good things which we want to instill in our children, if we don't have them and we are instilling them in ourselves, so there are two things being done together. Ek to we are instilling the positive things into our own, positive habits into our own being. And secondly, our child looks at them and then grows up. So it's two sides of a sword. Another thing I want to tell you is this punishment and anger and these things, as you all know, they don't work. Because if you yell at a child, if you scream at a child, two things happen. He learns the behavior, and most of the children are yelling and shrieking all over the place and at each other and at school. If you hit a child, maybe he doesn't hit you back or hit because you are, of course, the stronger one now. But then over the years, when they grow up, or they may be hitting their siblings, or they may be having they'll become bullies in school and try to hit the other ones. So this learned behavior of punishment and hitting and scolding and yelling passes on very, very rapidly to children. In fact, I feel that negative behaviors pass on more rapidly to children than to positive behaviors. Take time for children to inculcate from their parents. They go slow. So the parents say, ma'am, itte din se padh rahe hai, tab bhi nahi, still he is not reading. But I said, go on, keep on doing it. But if they start, yelling and shrieking, immediately that behavior is picked up by the child. So if a child is angry or he's a bully at school, so just see where that thing is coming from. It's either from home or from the movies, or maybe he's seeing it in school itself. So it's very important to find out the root cause of everything and take help for that. Other than that, I would also like that today I just read somewhere and I really liked it, that uh, the uh, the best word, uh, when you tell someone to be silent, you tell them to be quiet loudly. And we are always doing it. Be quiet, be silent. So if we, I really liked it. Like when you're telling someone to be quiet and silent, we are yelling and telling them to do that. Chup raho. So you're yelling chup raho, how are they going to be chup raho? So silence is something I want to talk to you. A parent says ki ma'am, how do I understand what to do? I get so confused and so angry. So the only thing is silent. Keep your eyes and ears open, observe and listen. When you observe and listen to your children, you learn a lot of things, you come to know a lot of things. And keep your mouth shut. So this, in that silence, intuitively you'll come to know कि problem ये है, अब मुझे ये करना. You'll also come to know that maybe he's in some sort of a trouble and he needs more help, and you may go for help. You may go to give the person, to give the child help from a counselor or to a. What I want to say is go and take help. There's no stigma attached to mental health at all. Parents should be very happily and readily taking children out to counselors and doctors and psychologists if there is any problem, because health is paramount and mental health is the paramount thing. Because once this thing goes off, once a child, every physical ailment has some treatment or the other. Mental illnesses also have treatment, but then they do have some very hazardous or the psychotic part of the mental illness, which is very difficult to treat. So let not the children go, and stress is the root cause of all these things. So let children be happy. Don't yell at them, don't scream at them, don't criticize them, don't blame them, don't complain to them. Don't talk about your sad stories to your children, about what you have gone through. Don't talk about your financial crisis to your children. Of course, you have to tell them to be careful with money. Of course, you have to when they are teenagers, you have to understand the fact that they are going through a lot of turmoil. So teenage parents of teenage children should understand that they are going through a lot of turmoil and they're going to end up in 2-3 minutes more. So, and that turmoil, that child is so confused inside. At that point of time, if you sit down and lecture to him, nothing is going to happen. So you have to be empathetic and be in his shoes to understand what he's going through. And the connecting part, a child will only, I'll just end up by saying that a child will only listen to you when he feels that and he understands that whatever you are saying as a parent or as a teacher or as a friend is 100% for his benefit. When that intention is clear to him, whatever is being told to him is going to help him, he'll listen. But until that communication part of yours is, and that bonding with your child is not set, that he understands your intention, he will not listen to you. So keep on talking, keep on learning the skills of communication, take help wherever possible, and be better, happy, satisfied parents, because your tone, your thinking, your behavior affects your child directly. I think I've touched up most of the important points. If there's any queries, we'll take it up.
Ma'am, a few questions which come to me very regularly. I think I should put up those questions and let the parents hear the experts. Ma'am, one question which regularly comes to me, ma'am, ये तो सुनता ही नहीं है. I can't help it. ये नहीं सुनता. And this is when I come across children who are in nursery, who are in KG, and the parent is sitting right in front of my table and saying, ये सुनता नहीं. So yeah. I mean, yeah. So आप क्या कहना चाहेंगे मैम ऐसे पेरेंट्स?
यही कहना चाहेंगे कि अब नर्सरी केजी के बच्चे को तो उसकी वेवलेंथ ही आपकी वेवलेंथ से मिल जाए, इट्स अ बिग डील, because it's always out of network area. Parents, as I said in the beginning, they just start off rambling and telling them ye mat kar, wo mat kar, on and on and on and on and go, and it doesn't register to the child. So when these children are smaller, when they are younger, nursery, KG, say 5, 6 years old, You don't have to give them big lectures. Just give them, your communication part has to be very clear. Just give them smaller sentences. Be assertive, not angry, and be very clear with what you want to say. Sit down there for some time. That is good enough. So when they are not sitting down, then you have to take, first of all, you should be sitting down also with them in the beginning part of it. Once they get into the mood of it, it will continue. And secondly, of course, if they have these problems where they are not listening or they are not, be very careful that there are a lot of psychological and psychiatric problems which affect the mental health of a child. You have to be careful that he doesn't have any learning disorder, or he's not hyperactive ADHD, or he's not autistic. Rule all those things out if you're feeling he's not appropriate in his behavior. Otherwise, smaller sentences, and then the moment he does, and smaller time period ke liye, not sit down there for 1 hour and work. A nursery child won't sit for 1 hour.
Ma'am, even
Smaller
the regularity and the timetable, I feel, because one day you expect, you don't look at the child for 5 days, and the sixth day we expect them to sit and study. So sixth day he will not be listening to you because the previous 5 days you didn't work with him. So
definitely,
yes, ma'am.
So then you have to be very stable in that. You have to be very stable, and you have to be very consistent is the word. Yes. So if you are going to sit down with him after his meal, he has to do his homework. So make it a habit. Don't say, "Acha, chal, today you sleep, tomorrow we'll sit again." So parents should be consistent.
Absolutely.
And with older children, if they don't listen, the issues are different, because
absolutely.
Teenagers, of course, have their own issues, growing up issues. So you have to listen more to teenagers than they listen to you.
Absolutely. Ma'am, most of the questions are already being answered in the session. Just because board exams are coming and we have a lot of 10th and 12th students, I can see one 12th smiling also. Ma'am, some of them do come with exam anxiety, or they feel little restless. So any suggestions for them?
What I feel is that, of course, exam anxiety. What I feel is that definitely you cannot say that just don't be anxious and exams, you'll do well. You have to be consistent again of your whole year long. So if a child has studied regularly the whole year long, it's revision time now. And of course, he'll get into the mood of it. And at that point of time, the atmosphere of the house and the parents matters a lot. So as I said, a stressed parents are more stressed. We all know this as study counselors. They are more stressed during the exams than the child. So naturally, they'll come up with queries that they're not sleeping, they're not listening, they're not studying, and I'm giving them food and they're not listening. So that hype in a parent passes on to the child, and of course, it makes them more anxious. So be very relaxed in the exam times in the house. Don't make it a war zone, of course, and let it be normal. And the work of a parent, as I tell them, is you just have to give them good food, give them a peaceful atmosphere, don't party at that time, and of course be there with them. And if they have these small problems, help them solve it, and don't put expectations on them. So let them enjoy their studying, and they'll only enjoy it if you enjoy seeing them study. So your behavior matters.
So ma'am, that's an excellent suggestion. Exam hai, no war zone nahi hai. So let's not make the house a war zone. So beautiful message,
house mein, let it be absolutely.
Yes, ma'am. Aradhna ma'am, thank you so much.
I think Anya's parent with us. Anya?
There's a parent with us, ma'am.
Yes, we have some parents also with us.
Yeah.
Anya?
Yes, ma'am. I would like to introduce them first.
Yeah, sure.
Yes, ma'am. Ma'am, we have Mr. Ankur Gupta, father of Anya Gupta and Avya Gupta, from classes 12th and 7th respectively. So please begin with your question.
Thank you, ma'am, for the session. So my question is that nowadays children are more influenced by social media, their friend circle, and they always think that what the parents are telling them is probably not right. So how should we create an environment at home to change this kind of perception?
Is it exam time you're talking of, or general you're talking of?
General, ma'am. I mean, they are more exposed to social media, the content, their friend circle, and they always try to replicate those things.
Bilkul. Now, what is going to happen is social media is not going to go anywhere. So we have to live with it, whether we like it or we don't. Now, the only thing that a social media time and that time regulation with the children is very important. I'm also taking up topics with your youth where I'm teaching them digital detoxification. So parents should do it first, So learn to switch off your TVs and your mobiles while you're on the dining table with your children, while you're talking to them. And then when you're talking to your children, your question is they don't listen to me. I answered this question in my talk also. I said, children will never listen, anybody. You are only listening to me because you are feeling that whatever I say is going to may help you in some way. So when you're sure that I'm going to get something worthy from you, you listen. That applies to children also. So make your conversation so good, your communication so good with your children, and that work you have to do on yourself so that your child feels that whatever is being told to me is for my benefit. And children 90% think that whatever the parent is saying is for their benefit. वो क्या बोल रहे हैं वो ऐसे ही बोलते रहते हैं. तो जब तक बच्चों को ये नहीं लगता कि इस और वो कम्युनिकेशन आप लोगों को सीखनी है, हाउ टू इंक्रीज दैट, कि देखो ये चीज मैं बोल रहा हूँ, इससे फायदा तुम्हारा है, एंड देन लिसन टू देयर व्यूज ऑल्सो, एंड देन दैट वे यू कैन मोल्ड इट. सेकेंडली, सोशल मीडिया को talk to your children, don't enforce laws. Whenever you're making some rules in the house, sit down with the children, and since it is for them, sit down with them and let them make those rules, and tell them, they'll tell them कि कितनी देर देखना है बेटा. So fix this detoxification and fasting, जिसको हम कहते हैं, fasting कर दो कि भैया इतनी देर मुझे 6 to 7 I want to be on social media. ये बाउंड, तो बच्चों को ये बाउंड्रीज बनाने दो अपनी, and then work on it gradually. So जब time fix हो जाता है, then let them be. अब वो क्या देखते हैं उसमें is another issue. Again, you have to talk to them and tell them that all sorts of things are coming which are fake, which are false. So be very careful of filtering all the negative news. So as I started my talk, parenting is all about the parent. So we have to increase our communication, our speaking skill, so that the child bonds with us. A child will listen to you when he is first bonding with you. बॉन्डिंग ही नहीं, आजकल तो पेरेंट दूसरी तरफ है, बच्चे दूसरी तरफ है मैदान के. एंड बॉन्डिंग विल ओनली कम व्हेन यू टेल योर चाइल्ड दैट आई लव यू. यू हैव टू टेल दैट. पेरेंट्स कहते हैं मैम ये कोई बोलने की बात है, अंडरस्टूड ही है. नो, tell them I love you very much and you're very, very valuable for me. And look, these things are good for us. So what is your take in that? So when you're making rules, sit and make rules with them, talk with them. Is that clear? Is it clear?
Yes.
Thank you, ma'am.
Yeah.
Thank you, sir.
Ma'am, I have one question. Most of the parents of teenagers, they have reported this issue that their children don't talk, share, and discuss with them as much as they with their peer group. So the parents, they feel left out, ignored.
Yeah. Yes. It happens, yes. And it's happened with me also, and you also. It happens with all of us many a time. In fact, I feel that when my children were growing up, there was nothing like parenting being told to us. We've just brought them up our own way. So today I have to say, talk to them and tell them, oh, I was so rude and I was so loud then, I'm sorry. So these are things which we do and we learn over the years. So your question is that children, today's times with parenting and all these awareness workshops, it's an empowered generation now. So what I feel is that number one, why the children, a teenager child doesn't listen is they have their own sets of these hormonal changes, and I tell you, they are very, very disrupting to the mind. Thought process ही बिल्कुल अलग चलता है, क्योंकि they are trying to understand what to make out of the world. Now, what is it that when they get confused, अरे वो तो smoke कर रहा है, why should I not smoke? And he's also doing well, and he has so many friends, and he's a big hero, big shot, and he's smoking, so why shouldn't I smoke? अब ये thought उसके दिमाग में आएगा, वो किससे पूछेगा जाके? With whom will he ask? The moment he goes to his parent and he says, Father, I want to smoke, Dad, because my friend is smoking, he'll get a slap. That is what parents do. They don't listen. This and supposing he goes and tells them that, Papa, yesterday I smoked because my friend gave it to me, so I smoked a cigar. Do you think any parent will accept it? They'll immediately start screaming. That should not happen. So what I want to tell you is that when a child comes to you to tell you something, however bad, horrific, hazardous it may sound, listen to the child and accept him. and accept his problem. Even if he's done something bad, which you feel he should not have done, accept it because he's already done it. So don't scold them, don't yell at them, because then they'll stop coming to you. They only stop coming to you because of your reaction to what they will tell you. So if they are coming to their parents and sharing everything with them, and they know that they won't get any shame, rebuke or anger from them, they will not go to peers, because sharing to wahi ho ja rahi hai ghar mein. Only in houses where there is less sort of sharing, there is a divide between the parent and the child, where the child feels that my parent is not going to listen to me or accept me, or is going to be angry with me. There he will stop bonding with the parent, he will not listen, and he'll go to peers, because wo log bhi isi kashti mein hai. They are all together having the same problems and they are listening to each other. तो वहां उसको जज नहीं किया जाता, घर में जज किया जाता है. वो करना बंद करिए, he'll come back to you.
Thank you.
Was it okay? Did you get the answer?
Yes, ma'am.
Absolutely.
Yeah.
Thank you, ma'am.
Thank you. Anything else?
Ma'am, this last question I'll take up from the chat box. One student is saying, if a student is addictive with internet or social media, then how parents can help the child come out of addiction? Basically, I think the child wants to know that I'm, at times when we feel that, yes, I'm too addicted to internet, how can I come out of it?
I'm starting this series of talks on my Fari Foundation project. If you have the time and you feel it, we can always have a talk on it. Detoxification and de-addiction.
Sure, ma'am.
It's especially of social media. Digital detoxification. It's very important, need of the hour. So what is happening is, what we are trying, we are discussing, one second. Yeah, so we are discussing that he is addicted. Now, little addicted or more addicted, kuch nahi hota. Addiction is addiction. Addiction ye hoti hai कि whenever you are hooked on to something, maybe it's drugs, because substance abuse है ना. अब तो internet और ये TV और mobile ये सब addictions का category में आ गया. So we call it substance abuse instead of drug abuse now. So what happens is that whenever you are into something, gradually you become habituated to it and you give it more and more and more of your time. And when you give it more and more of your time, it becomes an addiction. So the initial part is substance abuse, where it's not an addiction, but you can get out of it if you have the willpower, the knowledge, the awareness, and the empowerment. You can get out of it in the initial stage. That is abuse. And abuse is always of a substance which you know that is harmful for you for long periods. But if you continue doing it, it becomes an addiction. Addiction is pathology of the brain. It affects the brain. So when the brain neurochemistry and neurotransmitters get affected and there's a pathology of the brain, it is addiction. And there are compulsions, cravings, withdrawals, tolerance. That means you want more and more of it. When it's off, you get withdrawal, you get anxious, you get worry, and you feel like having it again. And there are cravings and compulsions, you want it. So that is abuse and addictions. Now coming to social media abuse and addictions is again, we all know it. We are all gradually becoming slaves of it. Instead of this mobile phone being we are in our control, it's controlling us. The notifications, the moment this ting of the notification goes off, that very moment, our focus to our goal of whatever we are doing is broken up. So our attention span is immediately broken up, whether we do it or whether we agree to it or not. But it affects our attention, and that is again leading to abuse. So these notifications should be turned off. What I feel is the digital detoxification is small times of fasting should be given to it. Like I said, make a time, from this time to this time I'll see it, other time it's going to be off my table. And when you're sleeping, don't keep it on your bed. Don't, give it a time. Set this time limits, 1 hour according to your convenience. 1 hour in the morning, 1 hour in the afternoon, or half an hour where I see my mails and my notifications. So don't be a slave to it. Because immediately our hands are going to these and seeing what likes I've got, who has replied to what. Even when it is off, we get attracted to it. Let me go and see what's happened in this much time. This needs detoxification. Like we are taking, detoxifying our bodies with fasts and with the other substances. Similarly, digital detoxification is a must, and the only way to do it is to stay away from it by giving yourself time periods when you will attend to it, and then keeping it away from you. And when you're going on holidays and when you're going everywhere, keep it off from you. The moment parents start doing it, children will pick up and learn from them and start doing it themselves.
Absolutely, ma'am. Even it's not only for students, also for us. Like as a teacher, I'm sharing that I'm doing digital detox. I don't use my phone after 9 o'clock, though I wanted to stop by 7 o'clock, but then you have messages coming from the school office. But yes, even we work, because sometimes we feel that even we are getting too much into phone and we want to see who has texted, we want to check WhatsApp, we want to check Facebook. So even we are doing it. I have started doing it. Thank you so much, ma'am, for sparing your valuable time. Thank you. Thank you so much. Yes.
Thank you so much. And you can always contact me with any queries, even if they come later on. My mobile is there with Aradhna.
Sure, so much.
Thank you so much. Thank you, Aradhna. Thank you.
Thank you, ma'am.
Bye. Thank you. Bye.
As we move towards the end of the program, I would like to take the privilege to propose the vote of thanks. I would begin by thanking our respected guest, Dr. Sona Gupta, for honoring this event for her presence. Thank you, ma'am, for your valuable guidance and words of wisdom. We are highly blessed and fortunate to have our principal, Dr. Anju Tandon ma'am, as pillar of strength and source of light and knowledge throughout our endeavors. Thank you, ma'am. I would like to express my sincere thanks to Mrs. Alka Jaiswal ma'am, Vice Principal BVB, for inspiring us to achieve our goals. I would like to express my thanks to Dr. Jyoti Devrishi ma'am and Aradhna Gambhir ma'am for their efforts in coordinating this enlightening program. I would like to extend my thanks to the IT department for their cooperation and management. I also thank to all the dignitaries of Bharatiya Vidya Bhavan's Mehta Vidyalaya for their precious time. Thank you so much, ma'am.
Thank you.
Thank